So the vaccinations that will be needed for travel all depend on the country that the traveler will be visiting. So that will be discussed more in detail at the actual travel medicine visit. Overall, though, I would recommend being up to date on the basic vaccinations such as MMR, Tdap, and if you're traveling during flu season, your annual flu vaccination. It's a good idea to talk to your doctor at least 6 to 8 weeks before intended travel date. That gives you enough time to be able to obtain the recommended vaccinations, as well as schedule your travel visits prior to departure. Well, there are lots of precautions, again, depending on the country that's being visited, but overall, travelers should ensure they use sunscreen, UVA and UVB, SPF 15 or greater. Ensure that you maintain good hand hygiene, so wash hands with soap and water, and if there's no soap and water available, use hand sanitizer. In terms of insects and mosquitoes, it's a good idea to use a repellent that contains DEET. Also, try to wear long sleeves, cool clothing and trousers. If you're staying in a hotel or home, make sure there are windows that have screens to prevent any mosquitoes from getting into the residence. Make sure when you travel, if you're engaging in any adventure travel, ensure safety at all times. Make sure you're using a helmet if you ride a bike. Also ensure if you're swimming, you are safe around water. Never leave children unattended around water for any amount of time. Just be safe. If you're riding in a car, make sure you're using your seatbelt at all times. Make sure you are following the local norms and culture. So it's a good idea to read out about any country you're going to visit. Limit intake of alcohol and ensure that whoever is driving you around is also not drinking. Just be safe during travel. So over-the-counter medications that could be helpful during travel include an over-the-counter anti-inflammatory like Aleve or ibuprofen or Tylenol. This will help with aches and pains or fevers. Also an antidiarrheal such as Pepto-Bismol. It's a good idea to have that. You might also need a sleep aid since jet lag tends to be a problem when travelers go long distances. Insect repellent, over-the-counter antacid to help with any stomach disturbances. All those medicines will be helpful. Other medicines that might be helpful include cough suppressants, cough drops, decongestants, just in case you develop a cold. Also, some travelers have motion sickness, especially if they're going on cruises or sometimes with airplane flights. So it's a good idea to have some medicine to help with motion sickness. And again, if you give yourself enough time prior to travel, you can get a prescription for some motion sickness patches prior to departure. So while traveling, or actually prior to traveling, it's a good idea to get the phone number of the U.S. Embassy located in the country that you'll be visiting. This is very important because the U.S. Embassy can serve as a source for names and numbers of physicians and hospitals that can care for the traveler while in that foreign country. Another good source of healthcare information is the International Society of Travel Medicine website. There are also medical facilities listed as well as physicians who are certified in travel health and who can take care of patients who are traveling abroad. It is also very wise to check with your health insurance company to ensure that you have coverage while you are traveling abroad, because it can be very expensive to have to be evacuated in case of any kind of medical emergency. Also, it's important to note the U.S. Embassy will communicate to your family and friends and your emergency contacts if there's any kind of medical emergency abroad. So it's a good idea to contact them a few months before you travel out of the country.